Good afternoon and welcome to the Highland Waves podcast, coming to you from Marshbrook Studios, located on a bank of the world-renowned Margaree River in Cape Breton, Nova Scotia, Canada. On Highland Waves, we feature stories about the people, the places, and those who come to visit us here in Inverness County. I'm Pat Wall, your host, and today I'm pleased to have with me in the studio Mr. Jason McDaniel, a Margaree Forks resident who runs a family farm, a farm supply company, and is a well-known and respected Advanced Care Paramedic. Welcome to Highland Waves, Jason.
Thank you, Pat. This is great to be here.
Oh, that's good. We're glad to have you. Born and raised in Margaree?
Born and raised Margaree Forks, McDaniel Lane.
Okay.
As per the name. Yeah, definitely.
What inspired you to become a paramedic?
You know, I could look back as early as the age of 14. I wanted to stay in the area, wanted to make a difference in the area, and paramedicine was always one of those things that I had an interest in. Tossed around a few other options of medical background, everything from, medical sciences right down to CCA work, and paramedicine was always what I wanted to do. And as most high school or younger children, seeing an ambulance go by was always kind of interesting to me. I always had that drive to help people, and I wanted to try the exciting part of it, and I'm 20 years in now.
Here you are.
So
there are 4 designations in the paramedic field: emergency medical responder, primary care paramedic, advanced care paramedic, which you are, and critical care paramedic. Explain the differences a little bit.
So we started there's actually a 5th one there now too, Pat. We started with the clinical transport operator program now as well, which is at the kind of what is known as the transport operator. So they're driving patients from one place
Hospital
to the next.
hospital.
That's right.
Okay.
Low level emergency.
Okay.
No real medical care needed.
Okay.
The emergency responder program, an excellent program, which is kind of bridging those people who aren't quite sure about what they want to get into as far as pre-hospital medicine, and it's given them a taste of being involved in some high-stress situations, but also being involved in some low acuity things to get their feet wet, for other words. The primary care paramedic role which is what I started as at 19 years old, fresh out of high school, went to university, and that has exploded as far as medicine-wise goes. When I started at 19, I was giving 8 medications with a few other things added, and now they're up to over 25. So that role has really, really just exploded. They're doing baseline assessments on EKGs, medications for cardiac arrest, and right down to simple as giving somebody an eye drop. So a very large scope for a primary care medic. An advanced care medic, I went back to school for that in 2012. We give up to anywhere from 55 to 75 meds, and also stuff we carry from hospital to hospital on serious transports. We're the highest level as per ground ambulance, and I always say we're stopping and starting hearts, and we're trying to keep things rolling as far as the advanced side of medicine goes. We're intubating patients, slowing down heart rates, speeding up heart rates, and restarting hearts. The critical care paramedic program has dominantly been in the air for Lifeline program, but it's just starting to roll out now into the streets, when they have what we call the CCRU, which is the Critical Care Response Unit. And they're just starting this program to have 1 car per busy region. So Halifax, Sydney is next up, and they'll have 1 person on that car to do the really critical transports from one place to the next.
Where is the paramedic training carried out?
So now, the hub of everything now is Halifax. It used to be Maritime School of Paramedicine, which was then bought out by Medivie Health Services, which is also the company that owns Emergency Health Services, and just took over Newfoundland. They're in parts of Ontario, New Brunswick. So Halifax is where kind of like the hot center is. But there's sub-schools from Yarmouth right to Sydney.
Okay.
Yep.
And how long have you been a paramedic?
I'm just completing my 19th year.
Oh, great.
Yeah.
And since you are an advanced care paramedic,
Sure.
what is your role now in an ambulance? Does it change, or is it?
It's ever changing. So and the exciting thing about today's medicine is that there's all kinds of opportunities. So a regular day is that we respond to any and every call that comes towards us that we're closest to. And we also get called to calls that are skill level appropriate. So if I get called to back up a crew who has a sick patient that their scope has exceeded, then we get called to back them up, which if somebody is having some kind of cardiac event or respiratory event, that crew, their level of care has been exceeded, then they call someone like me in to go and assist them.
Are there communications between the ambulance and doctors at all times, or whenever?
Yeah, so we have an online doctor, online medical control physician who we can talk to at all times. And that's like, as an advanced care medic, I have to call for a couple of medications. I think only up to 3. The rest is all by our own discretion. But if we have any questions or any like concerns or want to just bounce ideas off somebody, we just make one phone call.
Okay. We have a cardiac arrest on the road outside, and you arrive on the scene.
Okay.
You diagnose it. Can you call in an airplane or a helicopter to that site?
No. So, I mean, as far as bringing in like a helicopter style to a scene like that, dominantly not. We transport to the nearest facility. We go to the hospital and then get more in-depth testing done.
Okay.
And then it does happen sometimes, but not too often.
Okay. And they have an advanced team on board.
That's right.
Yeah.
They do. That's right. Yeah.
Since there are 4 designations, how are these designations assigned to ambulances? Is there a protocol, or is
No? So it means it's the same as any other job, I guess. There's just job postings, and they post the job based on what's needed in the area the job is vacant. So if I leave my job tomorrow in Inverness and go to take a job in Shettycamp per se, they will post my job in Inverness for an advanced care paramedic or lower. So if nobody with advanced care status applies, then the next status down can apply as well.
Okay.
Yeah.
Where is your home base now?
So I work 2 days a week in Inverness. That's my home base. And I just started a brand new program in Eskazoni doing community paramedicine program, which is a huge addition to the health services for sure.
So when you say are you working out of Inverness and or Cargama? Or I'm sorry,
Eskazoni.
Eskazoni.
Yeah.
So they're a long ways apart.
That's right.
So what area do you cover? What does that encapsulate?
So what I tell everybody is I park my personal vehicle in Inverness and I work out of Nova Scotia. So we could be doing calls anywheres, dominantly somewheres, New Glasgow and then east. But if we happen to take a patient as far as Truro who needs to go towards Halifax, and there's a serious call, or we're closest to a call in Truro, New Glasgow, Antigonish, Port Hawkesbury, then it's a Nova Scotia service. We can do that at any time.
Okay. So how many ambulances are in that area, roughly?
Oh, I mean, every day changes. But I mean, every day there's like day and night shift as far as how many ambulances there is. But as far as the number of ambulances, I mean, it can go anywhere from 5 to 10 to 12.
Okay.
And we're always just all moving to cover off areas.
So you go outside of the area whenever you're called upon to do that?
Yeah, but then somebody else comes in to backfill for us.
So they backfill for you?
That's right.
What is the goal for the response time from the time the call comes into you to get there?
So the big thing is to arrive safe. So we don't, although it's, even myself before starting, they would tell us that, it would be, or in my brain, it would be, okay, let's get there as fast as possible. Mm-hmm. But if we don't get there safe, and we're no good to anybody else.
That's right.
Right. So it's all about, we have a certain amount of time. We have a 2-minute shoot time, we call it, to get to our ambulance and get moving. And then from there, we actually have to follow speed limits and traffic signs and like everybody else. Okay.
Often fire departments and police arrive at the same location, usually at the same time or just before or after. Is that always the case?
It all depends on calls. So, something like a a large call I mentioned before, like a cardiac arrest, then we have to have more agencies because there's certain protocols we have to follow as far as like notifying next of kin of illness and more hands to help with the actual emergency. And of course, car accidents, we need traffic control, we need extrication gear from the fire teams, water if we have a car fire. It all depends on the call. If what I always say is that everybody knows about 10% of the calls that we actually do. Because nobody knows about the calls we go to by ourselves when Granny has the flu for 4 days because there's no fire trucks, there's no cop cars. We just go ourselves.
Okay.
Yeah.
So if the ambulance can't show up, the fire department and the police maybe will show up.
Like, what would you mean by not show up?
Well, if the ambulance is not at a certain distance and can't get there as quickly as the fire department because they're closer.
Yes, exactly.
Yeah. Okay.
Yeah. So that's why we're always called the fire teams as first responders because they live so close to the area and in the area.
Yeah.
They'll generally get there first, unless the ambulance is close by.
Yeah. What training did they have compared to what you?
So they do a 5-day training, and they do. So it would be in between what we now call an EMR and what we call like advanced first aider. So they're doing, they're very well trained in airway management, like how to keep somebody's airway open during a cardiac arrest. They're trained well in CPR, how to use the AEDs, and just the big thing I always push home for any first responders being able to just be a comfort to somebody. They do oxygen therapy and such like that for people who have respiratory distress, but they also are there as somebody in the community, somebody who they know, to just give reassurance.
Comfort.
That's right, 100%.
In the area you cover now, which is basically 2 areas.
That's right.
How many calls do you get on an average 24-hour day?
It all depends. I mean, we do, I've seen days where I get what we call shutouts and we don't do a call, right? So, and then I see days where we don't have time to have a meal and I'm eating cold chicken and potatoes in the passenger seat of my ambulance on the way to the 3rd, 4th, 5th, 6th call. Okay. So it all depends. There's no math to it. There's no answer to why, and that's why it's still exciting.
Yeah. Emergencies are not planned.
That's right. There's nothing planned about it.
What are the causes of your most frequent calls?
Age. Yeah, definitely age. I mean, we're in as we say, the baby boomers are starting to boom out. We're getting to the point where people are getting older, slips and falls. A lot of it's based on environment too, right? Like when the first snowfall happens, nobody has winter tires on. When the first ice comes, everybody falls and breaks a hip. And then summer, everybody's outside doing things, more traffic, more people. It's a lot of it is time of the year population based, but a lot of it is just the fact that people are older. They're not as well as they used to be. When we all know, things get harder when you get older, and unfortunately, it's a part of growing up.
Do you get crank calls and unnecessary calls?
Yeah, we get. That's pretty. That was a problem more about 15 years ago. Now our comm center in Halifax is an amazing resource, and they do a pretty good job of deciphering what's real and what's not. Okay. All those calls are screened so well. I mean, now we get to call sometimes, and they're like, nobody called 911 here, but you can't catch all the ones, right? So.
Okay. So from northern Cape Breton to southern Nova Scotia and Yarmouth.
That's right.
If you get a call, it goes to Halifax first.
That's correct. Okay. Yeah, it goes to the comm center.
Yeah.
It goes to our CMP dispatch first in Truro.
Okay.
And then when they ask you, when you call 911, they ask you, do you need ambulance, police, or fire? That's when you answer ambulance and go right to Halifax.
Okay. Areas that have high drug usage or issues with drugs seem to get a lot of media coverage. Mm-hmm. Is that an issue in the areas that you cover in Cape Breton?
I think it's really I think it's a problem that we see everywhere. There's nowhere I would say is worse than the other at this point. There used to be highlighted areas, but right now I think it's a generically bad problem in Nova Scotia. I can't really pinpoint a place where it'd be worse, but it's definitely a growing concern everywhere, for sure.
What about calls, regarding violence and domestic abuse and all of that kind of things? Do you get?
Yeah, so
Is that frequent?
not really. I mean, RCMP are most times in charge of that.
Okay.
The odd time if there's injury, but nothing to say that we, don't do those things. But it's definitely on the lesser frequent.
Okay.
Yeah.
With the closure of small hospital emergency rooms, how does that impact what you do in terms of response times and positive outcomes?
Yeah, so the big concern with that is that we just have to transport farther, right? So when we transport somebody, used to transport somebody half an hour to a hospital, now we're transporting them an hour or more, right? So those things just add time on arrival at destination, and then of course getting back to your area.
Okay.
Yeah, it just adds more time of driving and more time of patient getting to where they need to be at.
Okay. Nova Scotia has a lot of things to look after in terms of government, and the health takes a majority of our budget in Nova Scotia, and everybody's vying for their share of that budget in order to do their jobs. Do you feel that the paramedic situation in Nova Scotia is relatively healthy now, or what's your opinion?
We're in good shape.
Are you?
Now, I mean, we had like everybody, there was paramedicine was no different than any other healthcare or a lot of workplaces after COVID. COVID had a large effect on people's numbers of workers, the availability of staff, the availability of everything, right? We've seen we, like a lot of workplaces, seen a large exodus during COVID because times were tougher, money was tighter, people were taking jobs out west, and just, people who were on the brink of retirement just decided to say, you know what, this is stressful, I'm taking a break, and I didn't blame them for that, right? They put their time in, but now we've actually hired, Nova Scotia has hired a large number of paramedics in the last 2 years.
Okay.
And I would say that our staffing is the best it's been in 10 years.
Oh, no, that's great.
Yeah.
What is the worst incident, if you want to divulge that, or accident that you've had to deal with in your career?
So I won't get into any details, but I mean, that's, I always say that that's an answer I always kind of don't give, but I can give kind of like a roundabout answer that, in almost 20 years, so 19 years this year completed, I always tell people to leave to the imagination of everything you think that you would see in 19 years, I've pretty much seen. Have I seen it all? No. Haven't seen it all, but I've definitely seen a lot.
Yeah. Are there times following a major incident where it takes a little time for you to get over it mentally?
I think, what I always say, Pat, is that now I find that I feel like now I take more time because I respect my mental health better.
Okay.
Because I've gone down the road of not dealing with calls properly and it coming back to haunt me, right? So, I mean, and anybody who's been in paramedicine or any kind of health services, emergency services for sure, has been involved in that. And I take more time now to let myself feel the feelings, I always say.
Okay.
When you stop feeling those feelings, it's time to reassess.
Okay. Does running a farm help you unwind?
That's exactly what I use, other than my wife and kids and family. That is the 100% best thing I've ever done as far as mental health, is to keep that going for myself.
Oh, good for you.
Yeah.
If you had to do it all over again, would you?
Oh, I wouldn't change a thing.
Okay.
I might change some days and some conversations but I wouldn't change my steps.
Okay.
Definitely not.
What can people do to help you help them in times of emergency?
The biggest thing we see today is a lack of understanding of what ambulance usage is for. With the unfortunate cause of not a lot of doctors available sometimes, it doesn't require us to call 911 to solve that problem. Just understand what an emergency is versus what emergency is not. Mm-hmm. That's the biggest thing I always say, because a lot of times we end up going to calls that are not necessarily emergencies, and then the ones that are emergencies are waiting, mm-hmm. and that's unfortunate.
I often, as I drive around the province, uh, I think about the signs at the people's driveways are sometimes not easy to see. So that must be an issue for you guys when you get a call at night and you try to get there and you can't find a number.
100%.
Does that happen frequently?
All the time, yeah. We, in some areas are worse than others. I feel like it's more, people are more alert to that now. But for a long time, we had a lot of places. I found that every town there was less house numbers than there was actually numbers on houses. And it makes a big difference, especially if we have houses that are hidden by other houses or trees and it makes it very difficult for us to see. So get your house numbers, and when you call 911, give landmarks. Because every paramedic in this province and every police officer and fireman knows landmarks. I won't know your address off the top of my head, but if you tell me a landmark, I know where I'm going.
Yeah. Okay. What advice do you have for people who find themselves in a situation where they don't know what to do?
As far as like a medical emergency?
Yeah, if it could be they could come across an accident on the highway, or hopefully it would never happen that one of their relatives falls down or has an apparent heart attack. What advice do you give those people?
The best thing I always tell people is that the worst problem we have, or the worst thing about not calling is that you won't know if you should have called or not. So if you call and we have to get there, have a conversation, have a laugh that, oh, everything's fine, nothing happened, nobody's hurt, we get back in our ambulance with no patient, those are the great calls. So if your hunch is telling you something is wrong, just call. 100% just call.
What should people not do in an emergency?
I could sit here all day and say don't panic, but I've been doing emergency services for 19 years, so I don't panic about much. But just try and make sure somebody is calm, somebody is relative, somebody is clear-minded, and that at least one person is kind of in charge of who's coming, who's calling, what everybody's doing. Make sure somebody is kind of the role taker there.
Okay. In general, in your opinion, can people in the course of their lives help themselves prepare for emergencies?
Oh, absolutely. If it's...
What do you suggest?
Not everybody is good at emergencies. You might be okay to call if I drop right now, you might be the best person to have here. But just, I guess, be open-minded that someday you may have to be that person to make the phone call 911 or to possibly jump on somebody's chest and do CPR. If your mind and your anxieties will let you do it at all, doing a first aid course is the best way to get over fear, for sure. Just to know the basics. Mm-hmm. Even if you're not the person that's doing the actions, at least you know the process, if that makes sense.
Yeah.
Yeah.
Yeah. Before we wrap up, is there anything you would like to add?
No, I just think it's totally important that, anybody who wants to get into any kind of health services, there is always going to be work. We are not turning anybody away. I don't work in the corporate side of things. I'm on the medicine side of things, but we have jobs for everybody, right? You'll have a lifelong job. You'll never have to worry about, being out of work, because we're in a society that always needs paramedics, nurses, doctors, CCA, technicians. It's a great lifestyle. If you're able to do it, it's a great lifestyle for sure.
So what advice would you give some young person who wants to become a paramedic? What should they think about before they start moving in that direction?
Just keep your options open, right? Don't turn down experience. Don't turn down anything that might open doors for you. When I was applying for paramedicine, and I was on a wait list because at the time I was 18 years old. I had no life experience. The numbers were not as, you weren't bringing in as many medics at that point because we were well staffed 20 years ago. A lot of older folks were still working. So I was on a wait list because I had basically nothing to contribute at that time. But I got in, eventually. But as a backup, I applied for CCA to work in the nursing homes because I wanted to have some kind of experience that if I didn't get in at that point, I would apply. I would have experience for a year and then reapply again, because then you're still getting that patient attachment experience.
Okay.
Just have a backup plan. Always have something planned to back yourself up, and make sure it's along the lines of what you want to do with your life.
Okay.
For sure.
Well, thank you very much for coming to talk to us,
It's been great.
especially about your profession.
Absolutely.
Which is a very important one, and one that gives every citizen comfort knowing that you're out there. And I wish you well.
Thank you very much, Pat. It's great being here.
Thank you to our listeners. Don't forget to hit the like and subscribe button so you can stay up to date. And remember, subscribing to Highland Waves is free. Our thought for today is by Abraham Lincoln, who once said, "Next to creating a life, the finest thing a person can do is save one." So long for now. Pat.